I sit them down and I say, how were you actually taught about love and how you love yourself? And usually it may be, uh, yeah, my mom said they love me, but they were really violent or they were really harsh or they were really critical. And I tell them, if we're not spoon fed love and shown healthy love, we learn how to lick it off a knife.
Hello, and welcome to Disruptors at Work, an integrated care podcast. We're excited to discuss the shifting ongoing concerns in healthcare.
My name is Shabria Mayne. I am a DBH candidate and owner of Mayne Counseling Services in Alexandria, Virginia. I'm also the special host for today's episode, and I am joined by a good friend of mine, business owner, colleague, Jessica Harris. She is a licensed professional counselor and owner of the Beauti Clinic in Atlanta, Georgia. Today's guest has an extensive background and expertise in supporting diverse groups and populations with navigating unique life circumstances towards self-improvement and overall healthier quality of life and experiences. Her passion for supporting others is what sets the stage for our conversation today. So without any further ado, let's get started. So Jessica, how are you today?
I'm doing amazing. I'm so glad to be here. Thank you for inviting me.
Thank you. I'm so glad to have you. I'm excited as well. So I want to pick your brain for a little bit, just let everyone know a little bit about who you are, your background, and what inspired you to pursue a career in the healthcare field.
Yeah, so I'm from North Carolina originally, and I've been in Georgia for over 8 years now. And what has inspired me ultimately is my own challenges. I didn't even realize I had negative body image and just some disordered eating with food, but I didn't realize that until I actually worked at an eating disorder facility. And that expanded my mind of like, wow, this is something that needs to be talked about more. And I've been rocking and rolling with supporting us and the community ever since.
Okay, wow. Thank you so much for sharing that. I think it's interesting how, as working in the helping professional, how we all have our own unique stories that kind of inspired us to move into that space to serve others. So I didn't know that detail about you. So that's really exciting to hear and also really motivating and encouraging as well. So thank you for sharing that. So how has your journey shaped your perspective as a provider so far working in the field, especially with that background?
Oh my gosh, there's so many different things. So when I began to realize and being in the space, give you a little backstory. My first disorder facility, of course, even me going in to work at this facility, I'm like, okay, well, I'm going to see a lot of white women and or white girls, and seeing what this is going to look like. And our first client was an African from a little girl that was 10 years old. And I was like, oh, wow, I didn't expect that. And what do we do with this? And really seeing the impact of um, colonized beauty standards and not being affirmed in her culture, and avoiding that. And then also the sense of control that she wanted to have over her life circumstances drove her into her eating disorder. And that was eye opening. And I realized as I continued on in this path and learning more how we're underdiagnosed, underrepresented, and we're not asked about our eating habits with doctors, with dietitians. It's you just need to stop eating. You need to figure out how to eat food well, or better, or exercise. But you're not asking, are you depressed? You're not asking about these other things that may be affecting your eating and your relationship with food and your body.
Wow, that's really interesting because in the point of a perspective shift, that was an eye opener. It sounds like just walking in and having this idea of what maybe the population of those who have eating disorders looks like, and then you just learning really quickly that that's not
Yeah.
always the case. Yeah.
Mm-hmm.
Wow. Wow. Okay. So I'm assuming that's a part of maybe what drives your work today is just kind of knowing how diverse even that group looks like and even
Yes.
having your own experience. Yeah. Yeah.
Yeah, it really drove wanting to like represent us and being in this space because um, there's been so many things that we've lacked over the years. And I'm like, how do we, not only for myself and being and standing in the gap and exposing and supporting, but educating other therapists, other dietitians, other people of in the medical personnel and field about like this is a whole thing that's happening that we need to be aware of.
Absolutely. And that awareness and that insight that you bring into that space, not just the personal experience, but the awareness and the insight, I would assume also just kind of fuels like your approach to providing services and also that education piece that you mentioned, right?
Oh yeah.
Just, yeah, yeah.
So
Hmm.
I was gonna ask you, how do I do that?
Yeah, absolutely. How do you all of this in that approach as a therapist with that background and that insight?
Yeah, I really bring it down to earth with them. And here's the thing: we know that there's still a stigma about therapy, and then there's definitely a stigma around like I don't have an eating disorder. So I have to bring it down to my clients, like, okay, well, what were the phrases that was told to you? Was it, I know for me, my mom, clean everything off your plate. So my little body, you're trying to eat, and my mom didn't have portion control and all these other things.
Uh-huh.
So I'm like, oh, I need to eat everything off my plate. And I remember in grad school, I'm like I'm still eating everything on my plate, even though I'm full. Or the different things that's just in culture. I was literally just talking to a client about this yesterday. Of she's Caribbean. She's like, they always got to talk about your body. They don't even say hello. They just like, oh, you gain weight,
Hmm.
this or you that, and you make these comments. And I've heard also on the other side of, oh, well, you're too skinny. You need to eat something. Like, there's so many different things. It's like, well, what is it? So I break those things down of, oh, if you had these statements to you or these comments or these criticisms, what did that make you think about yourself? What did that make you think about your body? And unfortunately, in a lot of ways, culturally, Black women have been over sexualized as well. So then that's the component. And we have to dive into those things of like really connecting with our body in a negative way because of what society has put on us.
Beautifully stated. Because again, I think you're just providing the audience with just, or even reminding others, as well as like the cultural backgrounds of people and how those backgrounds influence the way we live, the way we work, the way we eat, right? And all of these different things that come into play that affect overall our functioning, our mental health, how we see the world, how we view ourselves in the world. So I love how you just incorporate all of that into your practice. It definitely
As
makes it more relatable and more practical. Yeah.
I
Hmm.
really try to take my time with educating them on what a healthy relationship with food is and with the culture components. You can still enjoy your culture and what does that look like in caring for your body. And even doing things of exercise. They don't have to be a hit workout. It could
Yeah.
be a dance, and you can make it fun. And then also with understanding that our beauty is so diverse. I talk about all the time. You don't look at a rose and a tulip and it's like, okay, they're, one is prettier than the other. They both have their own uniqueness. And ours come with color, flair, curves, and everything else. And I really get to take time to break that down for them. So it's a beautiful thing when they have those aha moments.
That's a wonderful metaphor. I'm loving this so much actually because I'm learning a lot as I'm just listening to you. And I kind of want to circle back for a minute to your business, right? The Beauty Clinic, because now it's kind of really coming together.
Yeah.
Can you provide a little bit of insight as far as I guess, the motivation behind the name of the business and actually how you operate within that business?
Yeah, so I call myself the beauty therapist first, and that's how
Yeah.
my clinic came about. So for you all that are listening, in Atlanta, I'm the beauty therapist. And the reason I call myself that is not only because of my specialty with culture affirming care and body image and eating disorders, disordered eating, but also I'm a professional makeup artist. So I actually found healing through makeup and care for myself through makeup and skincare um, along the way of my clinical journey. And then also, I again the stigma. I was like, oh, I can reach some women through beauty before I reach them with therapy. And once they were like, oh, Jessica, like this is what a therapist is like, or this is just talking to them about different things, they begin to open up more. It's just like almost similar to the hair salon with me with having the clinical skill. So that's how I blossomed the beauty clinic out of becoming the beauty therapist.
Wow. Okay. Yeah, definitely a backstory behind that. And just so much strength and just so much just birth behind it because it's a real, true, and genuine passion. So I love that. And I can ask you so many more questions about that. And I probably will in a moment. But thank you so much for expressing all of that. There's so much passion and love behind what you do. So just kind of moving forward, and just kind of further dissecting like who you are as a therapist and how you approach therapy and the people that you serve. Are you familiar with the social determinants of health?
No, I was looking it up, but I would love to hear from you more about it.
Yeah, sure. So, just quickly, the social determinants of health kind of refer to the conditions in which people live, learn, play, and so forth that influence their health and well being. So, it kind of focuses on economics, the type of money someone's bringing in, their socioeconomic background, their education and access to quality education. Sometimes we think about zoning and how that may impact certain communities,
Yeah.
healthcare access and quality healthcare, right? Sometimes when we think about certain communities, what's your proximity to a walk-in clinic or an emergency room and so forth. It also focuses on the idea of neighborhood and built environment. So the safety of that neighborhood, access to green spaces, parks, recreational centers, healthy grocery stores, and so forth. And also social and community context. So this looks like the social network that's around the area, community cohesion, public meetings, and so forth. So it's really just how is the community established in a way that allows for one to really maximize their potential in that space, to have access to all of these great benefits of just the human experience and how it impacts their quality of life. Does that make sense?
Yes, makes a lot of sense. And even with you saying that, my mind was just twirling because when I'm working with lower income families and wanted to provide that support, and I'm so grateful that I've been able to build my business so I can provide a sliding scale and those things to give them access, or workshops for moms and teens. And one of the things is access to quality food, or understanding how to grocery shop, and me being able to educate them on that. So that really does impact someone's quality of life, and just being able to care for themselves in the best way possible.
Right. No, that makes a lot of sense for sure. And I'm glad that you brought that piece up because I was actually curious about what you find to be one of the biggest barriers when we consider all those different points of the social determinants of health. You working in the Atlanta, Georgia region, right? And just even how uniquely situated that region is. What are some of the biggest barriers that you find that you kind of hit every time just serving the people that you serve?
Yeah, it's the barrier is not only when it comes to insurance, we know that that's a whole thing, but it's lack of knowledge. I find that I have a really hard time finding dietitians that are aware of eating disorders and how to treat it. Um, I find that just even sometimes cultural affirming care in the medical profession, I've seen where clients been blown off and not treated well, or oh, we're just going off of your BMI, not realizing that there's some other aspects to this that you need to pay attention to, not just you know a, just a check mark off their list. And it's really disheartening. I find that of course, when it comes to insurance, or a single mom that's just trying to do her best and struggle with even getting their child to getting mental health services, all those different things have been barriers, and I try to accommodate my clients as best as possible, as well as educate the community so it can be more of us that's serving.
A lot of really interesting points that you bring up just in that space. So many unique barriers that, of course, again, just impact the overall quality of life that someone could possibly experience. So that education piece, the time and the quality and the attention that it takes in a doctor's office, right, or in a mental health office to
Yes.
ask the right questions.
Yeah.
Yeah, that makes a huge difference in how someone receives healthcare. So thank you for sharing all of that.
Mhm.
Thank you. Have there been? Oh, I'm sorry. Go ahead.
Oh, I was just gonna add one more other thing, and I'm the reason why you'll hear me say education, education so much is because I have unfortunately had a couple of clients or people that are looking for services. Like, well, they said this, but then there's the other barriers of, but they don't need that. It's not really, that's not really a thing. And the parents actually don't get the client, their child, the care, or even the even say adults is signing up with me, but they're like, I don't know if it's that deep. Like, let's talk about this relationship instead of my body
Uh,
and my worth and my identity, which is really why you continue on choosing unhealthy relationships, and that's not just romantic, but that's friendships and all these other things as well. So
okay. So you definitely take the time to read into someone's life circumstance. You're not just looking at the surface, but you understand the depths of it and how just pulling up some things by the root makes a difference in how somebody even can approach therapy or their own health and so forth.
absolutely. I mean, it's all encompassing because if you see your body in a negative way and there's deep rooted shame, you are going to show up in the world in a different way. You're going to try to not take up much space. You're going to see how, let me be the people pleaser. And now I literally challenge my clients, we're going to change that from people pleaser to I'm self sabotaging. I'm
Mm.
abandoning myself and sacrificing myself for somebody else's needs and well being. And when you say it that way, it's like, oh, just that stings a little
Sounds
bit.
personal. Uh-huh.
It gets it
Hmm.
gets, real deal. And one of the things that I do share with my clients, and I hold their hand when I say this. I sit them down and I say, how were you actually taught about love and how you love yourself? And usually it may be yeah, my mom said they love me, but they were really violent or they were really harsh or they were really critical. And I tell them, if we're not spoon fed love and shown healthy love, we learn how to lick it off a knife. And when I share that, that's like, oh wow, it's a huge eye opener to, this is why I'm getting hurt all the time. You weren't taught boundaries. You weren't taught these other things of how to care for yourself. So it makes sense that you go to these other avenues for comfort and just trying to navigate life. So it goes very deep.
It does. The way you just described that, it even touches my heart, right? Because again, when you peel back the layers of how somebody functions and lives, how they see themselves right in the world that they live in, it really does allow them to see themselves from a different point of view, more of a personal, humanistic perspective as opposed to like the surface level. So I love how you just broke all of that down. It gets to the heart of the matter and the heart of a person. Yeah, beautifully stated. Thank you. Yeah. So I'm even curious again because of the passion that you bring into a space. I would imagine, right, that sometimes that's challenged or tested, whether it's within your own business or if you've worked for other places where that approach is not always appreciated or they're encouraging you to move in a different direction. I'm just curious, have you had any experiences like that? And if so, how did you navigate
Oh, don't get me started on this.
it?
I really have had quite a few challenges um, where I wasn't seen as competent enough or dismissed because of my skin. It's like, oh, how can you really help my child or me? And even let's be honest, like I'm plump and and I'm curvaceous, so I'm working at even sort of facility or talking to a client that's across from me that's thinner than I am, and they're like, how are you going to help me out? I'm not trying to look like you. So there's been different barriers with clients or people that are seeking support because of their own perception. But then also when it comes to an organization, um, there's aspects where it's not recognized, the cultural piece, and that can be seen as, oh well, no, this is how you heal, but I do bring a decolonized component to it. And what I mean by that is I do not I haven't subscribed for a while to, let me just sit with you and nod my head and, okay, like I heard what you I heard what you said, and let me just validate you. No, I'm going to tell you the real deal of, this is what's going on, this is what I'm seeing, and I'm going to give the the expressions, and you're going to get a real person that's across from you. And sometimes that has been seen as maybe a little unprofessional or unorthodox, but the clients, they can relate. The ones that get it, like as they say, the ones that get it, they get it. And
Mm-hmm.
it can be life changing, being that you see someone in front of you that represents a different way of therapy and is relatable. And as we know, when it comes to doing therapy, the therapeutic relationship is the one of the most healing parts. Goes beyond the skill, and me connecting with my clients brings a lot of healing. So I've seen. I'm a bit of a glamour girl, so some people are plain Janes and are like, you don't have to do all that, but my clients, they connect with that. I mean, we can kiki about welcoming of, oh, I like your shoes, and we can actually heal as well, and those many touches can aid in connection.
So definitely, again, your approach is more just humanistic, down to earth, right? And really connecting and developing that rapport and that relationship early, which facilitates the process in general. One
Yeah,
human, one woman talking to another person, right? And just
absolutely.
allowing that flow and that ease to come into the room so that some real work can be done.
Yeah.
So beautifully stated, Jessica.
I,
Uh-huh.
I definitely think it's just not understood that we professional you can be professional and be down to earth at the same time. And I think sometimes when you don't look a certain way, it's just not received. But people are waking up to being open to other forms of care. So that's
Right.
what I can appreciate.
Yeah, absolutely. Yeah, I think a lot of people do appreciate that. Like you said, if it's for you, it's for you and it works, right? So perfect. Um, Going back to the idea of maybe sometimes some of the barriers that you've run into, right? What are some strategies or solutions that you find could help overcome these barriers? It sounds like cultural affirming care or cultural competent therapists or professionals is definitely helpful, providing accessible resources, right? Or even sometimes referrals. And then also like that psychoeducation piece, just letting people know this is what this is, right? And allowing them to make informed decisions as opposed to just coming in and saying, I don't need this or I do need this,
Uh-huh,
right?
uh-huh,
hmm
uh-huh.
Are there any other things that stand out to you as far as these are solutions or strategies that could improve healthcare quality and accessibility?
Beyond other professionals being aware and educating themselves, honestly, doing our own work. A lot of us have not explored our own body image, our own relationship with food. So, how are you going to see it if you haven't seen it in your own life? I've even throughout my journey, I've made plenty of mistakes of saying, "Oh, like, of course, eat the cake."
Mhm.
It's like it is like, just that is not helpful. Even the little kid, the clients, the kids, they were like, just you don't say that. And I made my bumps in the road, but it's really I had to look at myself, and that can be a powerful tool once you're aware of your own story and how you look at yourself. So I would definitely say that. Another thing is, um, I I believe that when you when professionals actually look at how things are based, um, created in this country, uh, it will give them more insight to why things are what they are. So, for example, even with what healthy eating is, that's based from colonization, and a lot of people don't know that. Anything that was in our culture was stripped away. So there were a lot of things that were almost like demonized, that this is the wrong way to do it, so this is the right way. And looking at those things, where did the idea of, chicken and broccoli is,
Mhm.
the healthiest, one of the healthiest meals in a sense. Um, so really, I mean, taking a deep dive into history, that really helps give a lot of insight on why we say these things and what's actually really true and authentic to me, along with actually caring for myself and my well-being.
That's a really amazing point too, because again, everybody's body composition is so different. Everybody's background and genetic makeup is so uniquely different. So the standard can't be the standard, right? And it's time to like kind of debunk that myth about what is healthy eating, what is a healthy dietary routine, how does this work for you as opposed to what works for somebody else,
Yeah,
right? Yeah. Mhm.
absolutely. And then we know that there's a lot of diet culture, and even I have a client that's like, yeah, I'm doing intermittent fasting, but you about ready to pass out. Like that
Mhm.
doesn't work for your body. That's not something that is, you jump on the bandwagon because it sounded good and you see a lot of people doing it, but that doesn't mean that it works for you. So
Right.
I'm always sharing, you don't need to share, you don't need to follow someone else's formula. You need to get to know yourself, your own body, and what you appreciate and what you can do. It's okay to have goals, but be flexible and be willing to learn yourself versus what someone else is saying.
Perfect. And I'm also not going to move on without highlighting the point that you made initially when I asked that question, as far as looking within oneself as a therapist and bringing that type of insight and self reflection into a space. Because, yeah, it's important in order to serve others. Well, sometimes you go through your own walk and your own journey, and having those tools, that set of insight and understanding about the challenges and the things that we put off, or the things that we say we suppress, even saying, no, let me do a look at me in the mirror, and then I can look at some how to support you better because I've walked through it and I know what this process looks like. Yeah. Mhm.
Yeah,
So I'm
absolutely.
so glad you brought that up. hmm So collaboration is key in addressing systemic challenges, right? And I think you and I have talked off camera about different collaboration activities and opportunities in the community. For instance, one being like the CHIP program, community health improvement program in one's community, and just other ways to just get connected to the needs of the communities that you serve. So for you personally, if at all, how have partnerships with nonprofits, community stakeholders, or other healthcare professionals in general strengthened your work and enhanced patient outcomes?
Yeah, so I have done some my own work with, providing workshops and again, creating sliding skills for clients, and group therapy opportunities for my clients. But I am really hoping that excuse me, that I can do more partnerships and contracts with government and community and nonprofits, because it is such a need there. And these people and populations, they don't have the access. So if I can make those connections and collaborations, I definitely can have a bigger impact. Another excuse me, another thing is, I do educate other therapists, and
Okay.
hopefully to expand to other dietitians as well, where they can be knowledgeable, because it's only one of me. And I want to spread the word so they can be trained and they can, have their own thing. And those are the ways that I want to collaborate more and some of the work that I've done. And I'm so looking forward to just doing more of that in the future.
Okay, perfect, perfect. So I think that actually answers the next question as far as innovations, right? And ways that you could drive meaningful improvements. And I think personally, you hold that responsibility of saying, not everyone has the means sometimes or the funds sometimes. So that sliding scale really does make a difference in somebody saying yes or no to a service that's offered. And then also your approach to not only educating your patients, but also educating other professionals,
Mhm.
because it starts and it just kind of trickles down, right? So, like you said, it's only one you, but you're full of so much, right? So, being able to give that to others and spread that type of awareness and insight and professional background information, just all of the things that can help shape a therapist to walk even in a better version of themselves as a helping professional. So I'm glad that you definitely see the role that you play on both sides of it and that you're willing to do that, because that takes a lot. That's
Yeah,
dedication.
no, absolutely. It's when I see a need, I'm like, how can we make this happen? And it warms my heart. My heart is full because it's I just know that I wish I had a me when I was growing up. Like when I was going through my own journey and realizing like, oh my goodness, I call it actually BOCD, beauty obsessive compulsive disorder.
The new one. We're gonna keep that.
Sorry, I'm sorry, I'm basic. BOCD, beauty obsessive comparison disease. And
Ooh.
I would compare so much because of seeing people compare their bodies or hearing my mom actually make comments about other people. And I'm like, oh, well, she's saying that about someone. What does that mean about me? And I'm just like, I want this beauty therapy and the acknowledgement that we can love ourselves and care for our bodies in a culture affirming way to get out to the world. So I'm thrilled, and I'm hoping that anyone that is hearing this, they are like, yes, let me jump on the bandwagon and champion this message.
Absolutely. Wow. It's so much in your conversation that I would love to continue to ask about and pick your brain about, because I could see how far something like this can go. And I'm also just listening to you, Jessica, more inspired to ask you what's next, right? Is that a safe question to ask right now?
Yes,
Okay.
yes. Y'all,
Mhm.
I'm so blessed right now because I get the opportunity to do a TED talk in June. So I'm taking my horn a little bit, and I'm just so excited.
Congratulations.
Thank you so much. So I'm doing a TED talk, and I'm again, the word is going to be spread about beauty therapy and the need for us to embrace our own beauty, no matter the color and ethnicity. Um, and I'm also doing a derivative book about beauty therapy and your attachment to beauty and body image and body confidence with my therapist bestie. So we already came out with a best-selling book on Amazon called Attachment Style Makeover, and that
Okay.
is one of the approaches that I take with my clients of through attachment theory. So going through that, how do you actually attach with your body and connect with that? And we're taking that beautiful approach there, and that is going to be coming soon towards the end of the year, but it's coming.
All right, definitely look forward to hearing more about it and spreading the word and picking up the book. Thank you so much for sharing that, and congratulations too. You're definitely doing a lot and you're moving in your purpose. So I'm excited for you, Jessica. I genuinely am. This is so good. Yes, yes. Perfect. So before we close out, I just wanted to make room and see if there's anything else that you would like to share, not only about the beauty clinic, but also just about your efforts in the community, the things that you're paying attention to, next steps. Just want to see if there's anything else that's just on your heart and mind in that space.
My last statement I want to share is um, anyone who is listening, I encourage you to actually explore what is your beauty story. what is your relationship with your body? When you became aware of your body, what was that belief? And I want to encourage you to actually dispel it and actually speak truth into yourself. I like to say compassion statements, which is like, I'm learning to care for my body. My body deserves love and care because it's caring for me. And I really hope this conversation inspires you to change your thinking, how you see yourself, how you see your body, how you relate to food, and begin to explore those things because you are not alone. And to get the care that you need, I'm speaking on have the audacity to challenge your medical personnel when they are just focusing on your weight and actually explore what is the real issue. Is it just medical or is it some other deeper issue that um, you can care for your body instead of focusing on the weight? So that is my last statement, and I'm excited to serve so many more people, whether it's professionals or even clients that are looking to heal.
You will. And thank you. On that note, the vision of CGI is to improve the way the world experiences healthcare. And I want to say a big thank you to our incredible guest, Jessica Harris, for sharing her insight and expertise, which most definitely supports that vision on a larger scale. So thank you again for being here, Jessica. Thank you so much, CGI, for being a part of this. And I hope everyone just continues to do their absolute best as a helping professional in this beautiful big world that we serve. So thank you so much.
If you enjoyed this episode, don't forget to subscribe and share. Let's keep disrupting healthcare together. Until next time.